Hello, and welcome to the Mimosa Matters podcast series. In this series, we will bring you interesting perspectives on the clinical, research, and technological perspectives for near-infrared spectroscopy imaging, or NIRS, and introduce you to Mimosa Diagnostics. I'm your host, Douglas Queen. Today we are bringing you a Mimosa Matters poster chat, where you can learn from our collaborators about their important research. Today we are joined by Alexxia Richmond, the CEO of Excel Tailing in Snohomish in Washington State in the US. Alexxia is a board-certified gerontological nurse practitioner with advanced specialization in wound, ostomy, continence, and foot care, with a deep background in post-acute care settings. Alexxia combines rigorous training with a heartfelt commitment to advocacy. She's passionate about closing care gaps and improving quality of life for patients who often fall through the cracks for the traditional healthcare system. So welcome, Alexxia.
Thanks for having me.
Let me start our conversation by asking you a few questions about your poster entitled Point of Care Multimodal Imaging in Mobile Wound Care, Insights from a Case Series, such that our listeners can get some insight into your experience with NIRS imaging. Tell our listeners a little bit about your clinical practice and experience.
Sure. I own a mobile wound care company, and we serve the Pacific Northwest, Seattle and surrounding areas. And a lot of those areas are very rural. So we travel to different facilities and patients' homes as well.
Great, thanks. Give our listeners some background into the study featured in your recent poster at the SAWC Fall Conference.
Sure. So when we started using Mimosa, we were using it in the post-acute space and also the home health space. And we needed a device that was going to tell us whether or not it was safe to debride, and also kind of give us the non-visual indicators of infection so we can determine with our clinical assessment whether or not we should prescribe antibiotics or maybe send the patient in or try to keep them at home and out of the hospital. But also in the rehabs, skilled nursing facilities, we wanted to make sure that the facilities weren't getting tagged on pressure injuries that they shouldn't be. So Mimosa helped us kind of determine some of these barriers on whether or not they should be considered facility-acquired pressure injuries, or whether or not we should proceed with debridement or if infection was a concern.
So what was the outcome of your study?
We found that Mimosa was very helpful in aiding our clinical assessment and making sure that we were able to see when there was poor blood perfusion and when debridement was not safe to perform. And then also when there was cellulitis brewing, or maybe even before we could see signs of cellulitis, like the periwound erythema, the changes in temperature, which are very subjective. It's hard to determine changes in temperature by using like the back of your hand. So it was nice to put some quantitative values to that. And also with our oximetry, just with our first case study on the left foot there and the right foot, it was telling us, kind of guiding the goals of care, because the family was kind of resistant to accepting the patient's condition, and this allowed us to see that it was progressing to the point where hospice was needed, and in combination with other things the patient had going on. And in case 2, with skin failure, it comes on very quick and unexpectedly. So the facility was worried about it being an acquired pressure injury. And of course, the family was very concerned and was blaming the facility. And with the use of Mimosa Pro, we were able to determine it's actually a perfusion issue. Nobody's fault, really, just kind of the situation and the patient, unfortunately, deteriorating.
Great, thank you. And how does this approach help with providing care through a mobile service like your own?
It's filling a huge gap. So difficult to get vascular exams around here, and most of my patients truly are homebound. They do all their appointments virtually, and they rely on other people or caregivers to do everything for them. So not having access to traditional labs and clinics, it's very limiting on what we can diagnose and what types of advanced procedures we can perform in the home. So it was really critical to my practice to make sure that I'm doing debridement safely and without harm to the patient, and that the facilities that I round at are also, fairly being cited. If it is a pressure injury that was avoidable, then, the mimosa can help us determine that. But when it's unavoidable, due to, organ failure, systemic related to the skin, then it's a helpful tool to diagnose that.
It is what it is, as they say. As with any imaging, lighting can have an impact on the quality of the image. Have you seen any difficulties with this in the multiple environments you see through a mobile service?
Yeah, there was a little bit of a learning curve to using the NIRS imaging at first, and I think controlling the lighting is a big factor. Also, the angle of the camera. So, like dimming all the fluorescent lights, making sure that the windows are closed. I think maybe other imaging devices you want like the brighter. I might I might be incorrectly speaking, but with a white background. And this one's kind of like it's the less light is better.
Okay, thank you. We live in a diverse world. Do you see any challenges in the management of your patients related to skin tone differences?
Absolutely. It's difficult to tell, even when you're experienced with all the variations and how wounds can present differently, even with skin tones that are less pigmented, where it's easier to tell with those color variations. And Mimosa helps address that. It's really revealing what the eye can't see, what we're not able to determine by cap refill or, palpation.
Great. So, what's the key message of your poster that you would like to share with your clinical colleagues?
When I first decided to get Mimosa, it was more of I kind of had the approach was this is like an insurance policy for my practice. It really was a security feeling and making sure that I was doing everything I could before doing advanced procedures, but also as service to my patients, making sure that they get the diagnostics they need. And now I can't imagine not having it. Like it really is such a useful tool that as we grow, I'm just continuing to make sure Mimosa is growing with us.
Excellent. Well, thanks, Alexxia.
Thank you.
Thank you, Alexxia, for giving our listeners an in-depth insight into NIRS imaging, Mimosa Pro, and its utility in clinical practice. Well, that's our poster chat for today. We hope you've gained some new perspectives on NIRS imaging and its utility in wound management. Be sure to visit Mimosa Diagnostics at www.mimosadiagnostics.com and visit our social media channels. Add your comments and learnings. We want to hear from you.